and good morning, everybody. And thank you to the organizers, Endeavour, for inviting me to speak about a topic that's very close to my heart, healthcare in Africa. So I'm going to speak a bit about myself and my background, and that will set the context for the rest of the talk. I've worked in venture capital for almost 10 years now, as a fund manager, first with Green Tree Investments, and now with HealthCap. HealthCap is a firm that invests only exclusively in healthcare and financial services. We were the first, or I was one of the first investors in both Paystack and Flutterwave back in 2016, so that allowed me to develop healthcare fintech expertise, and now we invest in those two sectors, healthcare and fintech. I'm a medical doctor by training, my master's is in finance, and I'm just finishing off my PhD in finance as well. In terms of our track record in VC, our first VC fund did a DPI of 5x, which means that we were able to return 5 times the money that investors gave to us. And that's important because I think that in terms of investment in the continent, particularly in healthcare, we need to be having exits and making good returns for our investors. So in this presentation, I will be talking about the healthcare opportunity in Africa, but using the fintech story in Africa to reflect on what I think is the opportunity for healthcare in the next 5 years. So everybody knows the fintech story, and when I'm speaking in America and the UK, I describe Africa as the world's fintech innovation capital. I don't think there's a more innovative fintech market than sub-Saharan Africa. And according to McKinsey & Company, the revenues made by fintechs in Africa are set to increase exponentially, 5 times the revenues by 2025, and that's super exciting. But when you look at the numbers, nobody would have predicted that level of success. When you look at the UK, the number of bank branches for 100,000 adults was 25. When you look at the American banking network, the number of bank branches per 100,000 people was 138. That's advanced infrastructure. And when you look at sub-Saharan Africa, the number of branches per 100,000 people was 4, compared to 138. So when you think back 10 years ago, you wouldn't particularly bet on Africa as becoming a financial services leader when other countries had far more developed infrastructure. However, through innovation and through technology, we were able to leapfrog over the physical infrastructure required for traditional banking services. And today, sub-Saharan Africa accounts for 70% of all mobile money transactions in the entire world. That's $2.3 billion per day. And the most impressive thing is we did that with a much smaller amount of venture capital than you'd see in Europe or America. So if you look in Singapore, for instance, the amount of venture capital invested per person in Singapore is $1,000 per person. When you look in America, it's about $800 per person. When you look in sub-Saharan Africa, the amount of venture capital invested per person is about $1, maybe $2. So we were not able to do just more with less. We were able to do better with less. And what does that tell me? That tells me that we have the capacity to use technology to leapfrog over existing infrastructure. And that also tells me that we have a comparative and competitive advantage when it comes to building robust, frugal technology resources with far less in terms of resources than would be required to build those same solutions in developed countries. So how does this inform my thinking about healthcare? When you look at healthcare, we're looking at the same kind of numbers. So in the UK, there are 280 doctors for every 100,000 people. In America, there are 278,000 doctors for every 100,000 people. In sub-Saharan Africa, there's 18. So again, we're seeing the same kind of situation that we saw in banking. Lack of human infrastructure, lack of physical infrastructure, necessitating advanced technological solutions. But this is the opportunity, and this is what excites me. When you look at the Fortune 500 in America, 4 out of the top 10 corporations in America are healthcare companies. When you look at I think his name is Dede Eyeson study on the outperformers, so companies on the public stock market that have grown 1,000% over the past 10 years, 63 out of the 400 companies that he studied are healthcare companies. HealthCap, my company, produced what's called the Healthcare Unicorns Report 2 years ago. It's free to download online. Out of all the unicorns that have been created in the world, the 3rd largest unicorn-producing sector is healthcare. And unlike banking, healthcare creates a huge amount of jobs. The UK NHS is the largest employer in Europe, the 5th largest employer in the world. 1 in 13 Americans works in a hospital. When you look at every single state in America, the biggest employers are either healthcare or education. So healthcare is a massive industry, massive profits, massive revenues, and also a massive job creator. And I think that this is a big difference between fintech and health tech, is the jobs. And if we need anything in Africa with our high unemployment rates, we need jobs. So why do I think and why am I so excited about healthcare in Africa? First of all, there's the demographics. By 2100, Nigeria will be, by population, the second largest country in the world, outpacing China. We also have some of the fastest urbanization rates, some of the fastest internet access growth rates, some of the fastest mobile penetration, so more people are able to access the internet. The growth in the number of people that are able to access the internet is one of the fastest in the world. This is super exciting. And it's super exciting when you contrast it with what's happening in other countries. So Japan. I lived in Japan in 2011, and they sell more adult diapers in Japan than they do children's diapers. Whereas here in Nigeria, there are going to be more children born here than the whole of Europe. So the demographics are exciting. And what are the things I think, or the trends that I'm excited about in health tech? I think telemedicine is an exciting trend. Anything that brings the doctors closer to patients and reduces that gap in terms of the number of doctors. And that includes remote pathology, that includes remote diagnosis, that includes teleradiology. I'm also extremely excited about AI, and I think the first true AI doctor will be developed here in Africa because we simply don't have the doctors. I'm excited about electronic medical records. I'm excited about wearables. I'm excited about clinical trials and increasing the diversity of the people that go into those clinical trials to create new therapeutics. I'm also excited about the field of longevity and wellness. And I think that this could be a key way that Africa and African innovators in healthcare develop solutions for the world. So in conclusion, I've spoken about the journey that fintech has taken in Africa. And I've spoken and hopefully proven that we can do more with less. I've also spoken about my belief that we have a comparative and competitive advantage when it comes to building robust, low-cost technology companies that solve massive problems. I've also spoken about how we're able to leapfrog traditional infrastructure, like we did in banking, and I believe that will be the case in healthcare. And I've also spoken about what's unique, I believe, about the healthcare industry. It generates a lot of revenue, a lot of profit, but also a lot of employment. So in the past 10 minutes, I hope I've been able to highlight some of the healthcare opportunities, major trends for Africa, and the opportunity not just to make Africans, but the world a healthier, wealthier place. Thank you very much.